Hello, my friends. Today we will discuss emphysema. My name is Sameh Mikhail and I am a pathology resident. This is the Pathway channel. Please like and subscribe. So what's the definition of emphysema? Emphysema is irreversible enlargement of the air spaces, as we will see in the microscopic slide, and this happens distal to the terminal bronchiole with destruction of their walls. Small airways show wall fibrosis. And we have 4 types of emphysema, classified according to the anatomic distribution. So the first one is the centri-acinar or centri-lobular, more in smokers. The second one is pan-acinar or pan-lobular. Third, distal acinar or paraseptal. And the fourth one is the irregular. The pathogenesis in the main 2 types is either injury by toxic material in tobacco and initiation of inflammatory response. This one we will see in the centri-acinar one, or deficient or absent antiproteases as in alpha-1 antitrypsin. So let's go through the types. The first one is the centri-acinar or centri-lobular, and this is the most common type, and it happens in heavy smokers and COPD. This is like kind of a chronic injury that will happen with time, leads to the centri-acinar emphysema. It affects proximal parts of acini, and it happens mostly in the upper lobes of the lung. And distal acini are affected in severe cases. The pan-acinar or the pan-lobular is associated with alpha-1 antitrypsin deficiency, exacerbated by smoking. Acini are uniformly enlarged from the respiratory bronchiole to the terminal blind alveoli. So it's more massive. Affects mostly lower zones. So the centri-acinar affects upper, the pan-acinar affects lower zones. Distal acinar or paraseptal associated with spontaneous pneumothorax. Distal portion is affected adjacent to pleura, more severe in the upper half of the lung. We have the last one is the irregular emphysema. Acinus is irregularly involved from the name and mostly associated with fibrosis and scarring, mostly clinically insignificant. Thank you so much for watching the video. Let's go to the microscopic slide. Hello, my friends. So this is the slide of emphysema, and this patient is a smoker, and he had grossly, the lungs had massive bully formation, and this section is from the upper lung lobes, which are the frequently affected by centrilobular emphysema. So as we can see from this slide, we have huge space or like huge alveolar space, and these are the alveolar spaces. And as we can see, we have complete destruction of the alveolar wall in these areas, and the alveolar spaces, they are connected to each other. We have also very thin alveolar wall here. And sometimes you can see in the emphysema slide what we call the floating strands, and these are actual detached fibrous strands. And because the slide is a 2D dimensional, we can see where it is attached to the wall. So again, this whole slide shows the same finding of these floating things and the destruction of the alveolar wall and the massive enlargement of the alveolar spaces. Let me show you another finding on this slide. So this patient was resuscitated before death, and on the autopsy, we found around 4 broken ribs on each side. And this is a blood vessel. So in this blood vessel, we can find here some sort of a tissue with adipose tissue. So this is a bone marrow tissue, and this is a frequent finding in patients who had resuscitation before death. This is what we call bone marrow embolism. Again, all the lung area here shows this massive destruction of the alveolar walls, and they are all connected to each other. And in this patient, we couldn't differentiate whether this is centrilobular or panlobular from the extensive emphysema he had. So this is again a bone marrow embolism in this blood vessel. Again here in these two blood vessels, we can see here again bone marrow embolism. And again, all the alveoli here are showing the same findings as we mentioned. Here we can see also some foci of peribronchial lymphocytic infiltration, which is consistent with respiratory bronchiolitis that is secondary to smoking. Here again, some inflammatory infiltrates. And this blackish discoloration is the anthracotic pigment-laden macrophages. Again, here we have anthracosis and some inflammatory cells. Thank you so much for watching the video. Please like and subscribe.